I'm Raylan Nestor, and I'm in the MUW BSN program, and this is a PowerPoint about the national opioid crisis. So my objectives are that by the end of the presentation, the learner will be able to state 5 drugs that are classified as opioids, be able to state the decade in which it seems the opioid crisis had its first wave and first began, be able to recall 3 signs and symptoms of opioid abuse in lay people, as well as 3 signs and symptoms in healthcare professionals, and be able to name 2 ways that they can help out with the opioid crisis. Alright, so the national opioid crisis, so prescription drugs such as oxycodone, morphine, Demerol, hydrocodone, oxymorphone, these are all classified as opioids. Fentanyl is as well. It can either be prescription fentanyl or it can be illicitly made, illegally made. So it's under the illicit opioid category along with heroin. A major part of opioid abuse is overdose. Death from opioid overdose was 4 times higher in 2018 than compared with 1999. And 450,000 people died from opioid overdose in that time frame. In the 1970s, typically physicians only prescribed opioids as like a last resort or gave the strongest medication to cancer patients. Some studies were conducted in the 1980s, stated there was a low possibility of opioid addiction, and pharmaceutical companies ran ads that basically ensured the safety of their products. This kind of gave doctors the false sense of hope, I guess, that they could prescribe opioids more to their patients with little to no consequence if there was a low risk of addiction. So the first rise in deaths began shortly after that, after the doctors started the opioid prescribing increase in 1990. The second one in 2010, and it appears that people at this time frame switched from prescription opioids to more illicit opioids such as heroin. And then the third rise was noted 3 years later in 2013 when it appears people started using illegally made fentanyl that you can actually lace cocaine, heroin, and counterfeit pills with. Alright, impacts of crisis on the healthcare system. Prior to the opioid crisis, people who had substance abuse issues typically were not treated in hospital settings. It was more mental health, substance abuse settings. But the longer that the crisis has gone on, people's health began to decline. So more often than not now they are seen in a hospital setting just because they might have to see specialists while they're at the hospital, such as pulmonologists, cardiologists, neurologists. So they are better treated in the hospital setting. Also, social workers have started becoming more involved in their discharge, just trying to find them outpatient treatment if they want that, or maybe a halfway house, or helping them try to find resources to get jobs, stuff like that. So they're more involved with the discharge. 430,000 emergency room visits were attributed to opioid overdoses between 2017 and 2018. This is putting a lot of strain on the hospitals, not just because of longer wait times, but it's overwhelming the staff as well. Technologies had to improve so that physicians, nurses, and social workers can all speak and communicate in one patient chart so one can know what the other is doing for this certain patient. Non-medical use of opioids cost the United States $53.4 billion in 2006 alone. Of this cost, approximately 6% directly affected healthcare, 4% due to treatment for drug abuse, which was $2.2 billion, and 2% due to medical complications that cost $944 million. And insurance costs directly related to opioid-dependent diagnoses rose from $71.66 million in 2011 to $721 million in 2015. So signs and symptoms of opioid abuse in lay people, poor hygiene, decreased judgment, decreased motor skills, frequent change of job, frequent absence from job, trying to stay away from friends and family, not being very communicative, being paranoid, irritability, and pupil constriction. and signs and symptoms in healthcare professional, also frequent change in jobs, excessive bathroom breaks, offering to administer narcotics to patients in which they're not the primary nurse, financial trouble, relationship, family strain, falling asleep at work, odd friendships with certain physicians who may or may not be prescribing them the medication, and multiple work errors. So assistance within our communities. Our doctors within the department where I work, the emergency department at Baptist, they are trying less to prescribe opioids, that, only if it's a severe injury or cancer patient, stuff like that. They reserve opioids for that as much as they can, especially if they're writing them a prescription to leave the hospital with. Also, there is a program called the Prescription Drug Monitoring Program. So this program, they can look up and see the quantity of controlled substance a patient got and when it was picked up, so that they can perhaps see if the patient is doctor shopping or going to multiple doctors to receive controlled substance prescriptions. Also, within our community, we have several treatment centers and counseling services, Pines and Katy Hill Recovery Centers and Addiction Treatment Center, Pathway Healthcare, the Last House on the Block. Then we have halfway houses such as Recovery House. Community counseling offers counseling. Mississippi University for Women offers student counseling for mental health or substance abuse. And then Baptist, we have our behavioral health unit as well. How can we make a difference? Well, we can remove the stigma of addiction by speaking openly and honestly in a loving way with our loved ones and friends, to remove the negative stigma of addiction. Research and sign petitions for insurance companies to fully pay for treatment. A lot of people are reluctant to get treatment just because of the financial burden that they're scared they will endure if they enter a facility. So I think it would help a lot if insurance companies, at least the first time, would fully pay for treatment. Ask for funding in the federal budget by writing to Congress and asking for it. Educate patients about the incidents, signs and symptoms, and ways to prevent opioid addiction. Start a fundraiser within the community for families suffering from opioid addiction or substance abuse, and it also raises awareness while you are raising money. And become acquainted with ways to administer Narcan or naloxone to others in the event of an opioid overdose. And those are my references. Thank you.